Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today's topic is GERD, gastroesophageal reflux disease. And with me is student Dr. Chen. He's going to be talking a little bit more about signs and symptoms and the treatment that we will be using for treatment of GERD. GERD is the esophageal reflux disease, and this is theorized as a weakness of your lower esophageal sphincter. This is the bottom portion of the esophagus leading to the stomach. This weakness sometimes causes the food and acidity and stomach contents to go back up the esophagus, damaging the esophagus and the throat. Sometimes the signs and symptoms can be vague and not quite as understandable as you would think. And with me, Dr. Chen is going to give us the signs and symptoms of reflux.
So some of the common symptoms associated with acid reflux are heartburn, regurgitation, chest pain, and difficult swallowing. Some other common symptoms are chronic cough. You might be having a new onset of asthma or some persistent sore throat that you might be experiencing.
In addition, there is also contributing factors besides the genetic weakness of the lower esophageal sphincter. There are contributing factors as to why someone might develop acid reflux. And Dr. Chen is going to explain to us what those contributing factors are.
So some of the contributing factors might be weight of the patient. They might be gaining some weight recently. Some of the diet that they may be eating, such as spicy, hot food, and citric products such as tomato sauce that you can find on the pizza. These are some of the contributing factors for GERD.
Also, there's a bacteria that's well known to cause, or not necessarily cause, but contribute as well. What is this bacteria?
So this bacteria is called H. pylori. It lives in our stomach and also our small intestine. Some of the disease that it can cause are ulcers and even stomach cancer. So in the office, we can check for this bacteria by using an in-office breath test called the H. pylori urease breath test.
And I understand that this bacteria, when it occurs, can like the stomach acid. So even though you might have a lot of acidity, this might actually contribute to more of the acidity because it likes this sort of environment. And I understand that too, that the use of probiotics can maybe help in this kinds of case, but we don't quite know for sure. But to consider some of the dietary changes, weight loss, and maybe probiotics or some other healthy lifestyle changes that can reduce the contributing factors to heartburn and acid reflux. So that leads us to the treatment of this condition. The first treatment that a lot of people have used for many years is over-the-counter like Tums. These are little tablets that help to, neutralize the acidity in the stomach, but unfortunately, the long-term use has been associated with more acidity because it sort of suppresses the acidity, then the body overreacts by sending more. So the new version, or the better quality treatment, had been to change to the H2 blockers. That's actually histamine, right? We think about Benadryl as an antihistamine. This is a special histamine 2 blocker. This histamine 2 blockers tend to reduce the acidity in the stomach in particular and have been used for many, many years. The names of those are like famotidine or ranitidine, Tagament, and the brand names like Zantac or Pepcid. They work very well, but there has been a new class of medication that has come out to be a little bit more superior to them, and those are...
So those are the we call the PPIs, which means proton pump inhibitors. They work in your stomach to reduce the acidity in their stomach, but some of the side effects that it might cause are interrupt the absorption of vitamins such as vitamin B12 and vitamin D. So we don't want to use that for a long period of time.
There has been some new guidelines that been set up, and basically For conditions such as heartburn and acid reflux and gastric ulcers, they have actually recommended 4 to 8 weeks of treatments at the most. In other words, that the long-term use, which had been like daily use for months to years, has now been just like sort of re-recommended or evaluating the necessity for these long-term treatments because of the lack of absorption of certain vitamins, because of the increased risk of osteoporosis, because of the lack of evidence to show long-term benefits. So now they're saying you can use them for like 2, 4, 6, 8 weeks, but revisit this condition and see if stopping it is the right choice. Of course, this is between you and your physician. This is not a recommendation, but at least bring up the topic and discuss some options and think about whether or not you really even need this medication long term. In cases in which there's Barrett's esophagus or there is severe gastritis, there has been showing some benefits of using these long term. So again, don't just rush to conclusions that you don't need it, but it's important to get evaluated by your physician for it. So once again, this is a great quick topic about heartburn and acid reflux. We thank Dr. Shen, and soon to be Dr. Shen, actually after this, maybe next week?
Yes,
I don't know. He's
week.
finishing up his rotation with us, and we're really glad to have him here, and we look forward to him to coming back visiting us soon.
Thank you.
This is Dr. Jonathan Youssef, networking for your optimal health.